Multiple sclerosis, MS, is a disease that affects the central nervous system, the CNS, which consists of the brain, spinal cord, and optic nerves. Everything we do, whether it's taking a step, solving a problem, or simply breathing, relies on the proper functioning of the CNS. To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of nerve cells called neurons continually send and receive signals. Each signal is a minute but necessary part of intricate CNS orchestrations that culminate in the actions, sensations, thoughts, and emotions that comprise the human experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and viruses. But in MS, something goes awry. Immune cells infiltrate the brain and spinal cord, seek out the myelin, and attack. As ongoing inflammation and tissue damage occurs, nerve signals are disrupted. This causes unpredictable symptoms that can range from numbness or tingling to blindness and paralysis. These losses may be temporary or permanent.
People with multiple sclerosis tend to have their first symptoms between the ages of 20 and 40. Usually the symptoms get better but then come back. Some may come and go while others linger. Before being diagnosed with MS, some people may experience side effects of the disease. These side effects may include blurred or double vision, thinking problems, clumsiness or a lack of coordination, loss of balance, numbness, tingling, or weakness in an arm or leg. The more common symptoms MS sufferers may experience are abnormal sensations or a pins and needles sensation. They may also have numbness, itching, burning, stabbing, or tearing pains. About half of people with MS have these uncomfortable symptoms. Fortunately, they can be managed or treated. About 8 in 10 people have bladder problems, which can also be treated. They may need to urinate often or urgently or have trouble emptying their bladder fully. Bowel problems, especially constipation, are also common. MS can also cause muscle weakness or spasms, which make it harder to walk. Balance problems, numb feet, and fatigue can also make walking difficult. It is common to feel dizzy or lightheaded. They usually will not have vertigo or the feeling that the room is spinning. About 8 in 10 people feel very tired. It often comes on in the afternoon and causes weak muscles, slowed thinking, or sleeplessness. It usually is not related to the amount of work you do. Some people with MS say they can feel tired even after a good night's sleep. For about 40% of people, muscle spasms are an early symptom of MS. In progressive MS, muscle spasms affect about 6 in 10 people. You might feel mild stiffness or strong, painful muscle spasms. When imaging for multiple sclerosis, MRI is the modality of choice. The precise image produced by MRI gives the neurologist clear evidence of inflammation in the deep parts of the brain or spinal cord that is characteristic of MS.
When you get an MRI, many different sets of pictures are taken. I'd like to walk you through 5 key changes that these pictures can show. First, T2 and flare lesions. T2 and flare images make MS lesions in the white matter stand out as bright spots. Your MRI report might refer to these spots as hyperintensities. Classic lesions for MS tend to be deep within the brain around the spinal fluid-filled spaces, called ventricles. Oval or flame-shaped lesions are typical. Other brain lesions can be scattered in the white matter, especially near the surface of the brain. T2 and flare lesions are due to both old damage and new inflammation. People with MS with many T2 or flare lesions when they are diagnosed are at increased risk for disability. Without MS, usually no T2 spots are found in the brain until age 50. Other causes for white matter T2 lesions need to be considered, such as blockage of small blood vessels from smoking and from high blood pressure. Second, T1 with contrast lesions. When contrast is given in the vein, the contrast goes through your blood and seeps out of leaky blood vessels at sites with active MS inflammation. Typical MS lesions that are bright with contrast remain active for only 1 to 2 months. The spots may go completely away or leave behind a T2 flare scar. Some people with MS have a lot of active T1 with contrast lesions, while others may have none. Some individuals without recent MS relapses can still have ongoing MRI T1 contrast activity without new symptoms. Here's an example of someone with a lot of T1 contrast activity coming and going on a monthly basis over time. Third, T1 black holes. These dark spots on T1 scans are areas where there has been damage to both the myelin coating and the nerve cells themselves. Since these MS plaques are more severe, people with black holes, also known as T1 hypodense lesions, are at a higher risk for physical disability. Fourth, atrophy. As all of us age, our brains actually shrink. This is called atrophy. In MS, this brain shrinkage can occur more quickly. Atrophy is difficult to measure on a routine MRI exam, but it's important for research purposes. Atrophy is often measured during a clinical trial as the change in brain volume over 2 to 3 years. Here is an example of someone with MS who developed significant atrophy and T1 black holes over the course of 5 years. And fifth, cortical lesions. New ways of looking at the brain using MRI have shown that gray matter on the surface of the brain contains MS lesions. The surface of the brain, called the cortex, contains the nerve cells. Cortical lesions are poorly seen on a standard MRI, but new MRI research techniques are making these spots more visible. Cortical lesions are more common in patients with progressive disease.
After a person is diagnosed with MS, treatment should start as soon as possible to ensure a more comfortable life. While there is no cure for MS, many treatment options are made available. Treatment options range widely from oral medications to injections. These treatments are better explained here.
Dr. Kraft, what are the current disease-modifying therapies that are available?
There are quite a few, Kate, and I'd like to list them by categories. First of all, there's the oldest category, which is interferons. Then there's next oldest category, which is only one, glutathione acetate. It's 4 amino acids that mimic the antigenic site on the myelin. And then we have some infusions. We have monoclonal antibodies such as Tisabri or natalizumab. And then more recently we have the oral medications, and Gilenya is the new example of that. And one more category, and that is the chemotherapeutic agents such as mitoxantrone and that category.
Let's turn to Dr. Siegel on this one. What is the difference between symptom management and disease-modifying therapy?
Symptom management involves the use of drugs or other therapeutic interventions to alleviate or reverse symptoms that patients experience, such as spasticity, such as pain, such as fatigue. However, those drugs don't actually alter the clinical course of multiple sclerosis itself and don't stop the disease process. Disease-modifying therapies are used in order to actually suppress the inflammation and other destructive processes that are occurring and causing damage to the central nervous system in patients with multiple sclerosis. These drugs decrease attack rates in patients with relapsing or remitting multiple sclerosis, and hopefully also decrease the risk of progression or slow down progression.
It is generally very difficult to predict the course of MS. While the disorder varies greatly from one individual to another, most people with MS have a normal life expectancy. A few patients with a very severe disability may die prematurely of infectious complications, such as pneumonia, so that the overall life expectancy is about 95%. To better give you an idea about what a day in the life of a person with MS is like, we have found a small documentary of a young woman named Jessica. This is her story.
Imagine waking up one day, finding yourself disabled. Scary stuff, but it happened to me. First of all, I assumed that pins and needles were from sleeping on my arm. But 3 weeks later, the pins and needles remained, limiting my handwriting to that of a 5-year-old. But I didn't fret. In fact, I found it amusing, and I wrote notes for my friends. I had originally assumed that the pins and needles were from a trapped nerve, so I only became concerned when it started spreading. After numerous hospital visits, blood tests, MRIs, and a lumbar puncture later, I was diagnosed with MS. So what would this mean for me? MS, most simply put, causes some serious nerve damage. And when your nerves are damaged, some weird stuff goes wrong. For instance, I barely have an immune system. If you have a cough, a cold, the flu, anything, I will probably get it. Ah yes, the limping. That can range from fairly subtle to very obviously embarrassing limp. The double vision, that lasted for 4 weeks, randomly, and made watching TV fairly difficult. Injections, that was something I had to get used to pretty quickly. I have to give myself injections every day. And though you get used to it, you can never be sure it's going to go 100% right. There have been horrific moments of blood spurting up into the sky, well maybe not the sky, but a good 6 inches into the air. It can always be a bit disturbing. I have all the stamina of a 70-year-old. In fact, I think most 70-year-olds could beat me up the stairs. And due to this, given the opportunity, I would sleep for days. I'm a lot clumsier than I used to be. And then there's the dropping things. I'd say, though, the very worst thing about MS, more than the limpy leg, or dropping things, or even injections every day, is the fatigue. This cannot merely be shrugged off as a little bit tired. It is so tired that you feel weighted down. I've been criticised in the past for not taking the news of my MS seriously. And I know this is true. But sometimes isn't it better to be naive of the situation you're in and still remain happy? Especially whilst I'm still relatively healthy comparatively to how I could end up. This isn't necessarily my future. I might not end up this way, but it's still a concern.
More than 2.1 million people worldwide suffer from MS just like Jessica. Luckily, there are many organizations and groups that are on their way to finding a cure for multiple sclerosis. We are closer than we think to ending this debilitating disease.